Hello, I'm Lindsay Smith, and today I will be talking about depression and massage therapy. To begin, I would like to give the audience a short overview of depression, depression types, and symptoms of depression. True depression is a disorder of moods and attitudes a person may have towards life and everyday occurrences. The person may have feelings of sadness, anger, loss, frustration, or apathy. There are many types of depression that can affect a wide range of people. Situational depression can be experienced during particularly overwhelming or stressful situations. The severity of this depression is related to the person's ability to cope with these situations. A common situation that is particularly hard to cope with is a death and during mourning. Moderate depression is not triggered by an event, but is a reaction to social, economic, physiologic, and environmental stressors that can alter the mood of the person. This type of depression is usually altered by medication or seeking therapy for coping mechanisms. Severe depression is a more outstanding level of depression. People who suffer from severe depression normally have to be heavily medicated or hospitalized. The person may also need to speak with a psychologist on a regular basis and may need chemical therapy. The registered massage therapist will need to collaborate with the circle of care to monitor massage treatments. Chronic depression can be moderate or severe. Specifically speaking, chronic depression is more than one episode of depression or has been an ongoing diagnosis. It is common for people who have chronic pain or chronic diseases to have this type of depression. Treatment is normally a collaboration of medication and therapy. Massage should be monitored for treatment of people with chronic depression as well. Perinatal depression is a type of depression during pregnancy. This type of depression is caused by an increased hormones that can cause an imbalance of emotions. Feelings of depression can become dominating in the person, thus affecting the pregnancy safety. Postpartum depression is a type of depression after the woman has given birth. The woman may have feelings of isolation, identity loss, resentment, or anger. A lack of support can lead to this type of depression. Some certain factors can put you at risk for developing depression or depressive symptoms. Any alcohol and drug abuse because of their depressive properties and addictive qualities. Some medication conditions, specifically an underactive thyroid, cancer, or long-term pain. Certain medications and steroids, problems sleeping or staying asleep, stressful life events such as a breakup, failing a class in school, a death or a diagnosis of chronic disease, divorce, childhood abuse or neglect, job loss, and social isolation. Some things you may notice with the client who suffers from depression: agitation, restlessness, and irritability. The person may withdraw themselves from social situations or have difficulty concentrating. The person may have a dramatic change in appetite. The person may have fatigue or a lack of energy and may not feel rested after sleeping a full night. The person will have feelings of hopelessness and helplessness. The person may have feelings of worthlessness, self-hate, and guilt. They may have a loss of interest in things they used to do, or may have a loss in pleasure of the activity they once enjoyed. The person may have thoughts of death or suicide. Normally, depression is treated with medication. The most common types are antidepressants or selective serotonin reuptake inhibitors. Some medications used with depression are Prozac, Celexa, Zoloft, Paxil, or Lexapro. Some common side effects are nausea, headache, diarrhea, rash, increased sweating, weight gain, drowsiness, or insomnia. It is important to monitor your clients for these symptoms and modify the treatment accordingly. If the client is complaining of diarrhea or nausea, it is important to now massage the abdomen. As well, if the client is suffering from drowsiness or insomnia, they may need assistance in monitoring when getting off the table. Massage therapy can be used as primary intervention for treating depression and depression symptoms. The uses of massage can include reduction of edema by doing manual lymph drainage. This can reduce edema in peripheral tissue and create a sedative effect. Increase local blood flow by doing effleurage, rhythmic mobilizations, and stroking. Increasing blood flow will bring fresh blood and oxygen to the tissue. Decreases in muscle soreness or stiffness. This can be done by using neuromuscular techniques and PNF stretching. These techniques improve resting muscle tension and can improve the overall ease of movement in a joint. Moderation of pain. The therapist may treat trigger points that cause referral pain. Trigger points may occur because of poor posture that may have happened during depressive episodes. Energizing the client. The therapist can use stimulating techniques such as passive range of motion, hacking, pincement, slapping, tapping, and cupping. Finally, massage affects the connective tissue. The therapist may treat any contractures or adhesions from a primary pathology such as fibromyalgia. In a recent article, it suggests that connective tissue techniques improve the client's perception of pain. The therapist can use skin rolling, direct fascial techniques, and frictions. Hospitalized patients who receive massage express improvements in mood, body image, self-esteem, and perceived levels of anxiety. This phenomenon is facilitated by a reduction in physical symptoms and distress and may be accompanied by decreased tension, anxiety, and pain perception. For treatment planning, the therapist should work with the client to choose functional goals specifically for their own personal lifestyle. Some common choices are improve well-being and quality of life, and improve alertness. The client should also aim for 30 minutes of physical activity a day to help control depressive symptoms. Treatment goals for the client could include decreasing fatigue with stimulating techniques and improving mood, body image, and self-esteem issues by referring the client to another healthcare practitioner. The client should be educated with other options available to them. Some include depression support groups, healthcare practitioners such as a psychiatrist or a psychologist, a referral to a nutritionist or a dietitian. Therapists should recommend the client exercise and maintain daily physical activities. As well as therapists can encourage the client to resume their normal activities of daily living, encourage a normal sleeping pattern, and making time for relaxation. Every client is different, and it is important to develop a treatment specific to the client's needs. Tips for relaxation: meditation, journaling, soothing music, diaphragmatic breathing, yoga, tai chi, and hobbies such as photography, drawing, or writing. For more information on depression, please visit www.ontario.cmha.ca. Thank you for watching.